Hello, and welcome to a More Perfect podcast. Today we will be continuing directly where we left off, so this is part two of my interview with Dr. Mark Hash.
The most important thing right now, I'm telling you, is social distancing.
Okay.
And the best way to do that is stay indoors, stay in your yard. If you have to go out in public, protect yourself with a mask and gloves, decontaminate everything before you bring it in the house. And frankly, I take a shower before I leave the hospital. I put on clean clothes, and we're making minimal trips to the grocery store, minimal. And then when I get home, I undress to my underwear outside, and I turn my clothes inside out, and my clean clothes go straight to the washing machine. Because I don't know, they could have been contaminated by the air in the hospital. I don't know. I'm taking about 5 showers a day right now.
That's amazing. I mean, that's some real decontamination right there. And if you're saying it takes that to stop this virus, I think it really does underline how dangerous and how infectious this thing really is that we're dealing with.
Right. Well, one thing I learned, I'll tell you, I went through the Army's special training and all the NBC warfare, how to manage casualties.
Mm-hmm.
And the one thing I learned is there is no effective management.
There is no effective what?
There is no effective management after the first few days. And I'm gonna give you a perspective. I like to tell people: imagine being a physician in Hiroshima the day the bomb went off. How much help could they provide?
None.
Right, very little. And that's why the president is rushing resources into New York and LA. But those resources, if people don't stay home, the resources are not going to be enough. No. And again, I'm going to say it one more time. I can't say this enough. All people have to do, no matter your age, all you have to do is stay home, watch Netflix.
Yeah.
It's not hard.
No, it's not. Well, that's my friends. I am a very social person, and I've heard a lot of people say that too. It's hard for me, especially along with a lot of my age group. We like to meet each other. We like to go out, and it's hard psychologically for us. Not so much that it's a lot of exertion on ourselves. It's a lot of mental exertion. Now is the time. Now is the hour to do something. No matter how hard mentally it may be, you're saving countless people by doing this. It sounds like from what you're saying. Would that be correct?
Yeah. Okay. So frankly, it's the millennials that are spreading this.
Mm-hmm.
If you look at age groups, it's the young people. If a person's going to be asymptomatic, it's going to be the millennials and the adolescents. And there's reasons behind that. But regardless, it's not that you can think of this way. I mean, you don't want, if you're a millennial, you don't want to get sick.
No.
And you don't, but you sure heck don't want to expose your immunosuppressed grandfather or parents.
Yeah.
I mean, the older the age, the greater the risk of death, the greater the chance of dying from it. The mortality rate in somebody over the age of 90 is almost 100%. Over the age of 80, it's about 90%. So, I don't want to get this myself. I sure don't want to give it to somebody and they die and they get sick, and especially if they die from it.
Mm-hmm.
That's the huge risk.
Yeah. Yeah, it is. It is definitely this is just terrible. All we have to do is stay home. And speaking of staying home, I had a question from a girl named Elizabeth. She asks, why is there a curfew from 11 p.m. to 5 a.m. in Tallahassee? She says, is the virus nocturnal or something? She wants to know, about that, about the curfew and why those measures are being implemented. I think it's pretty obvious, but I just want to hear your take on it.
Yeah, I mean, the virus doesn't have really a mind of its own. It's not nocturnal. It's an equal opportunity killer, day or night. So the answer, this is all about decreasing exposure to the police, the fire, and decreasing the exposure to healthcare workers. I'll tell you, not much good happens after 11 o'clock at night. If you can force people to stay indoors, then you decrease the risk to the ERs, the fire, the police, because as this thing escalates over the next few weeks, you're going to need them.
Sure.
And
Yeah.
if they're out sick, then you lose protection of the police.
Then you're really screwed.
Right.
You have other problems on your hands when the police go out. God forbid that happens.
That's right.
That's I didn't even realize that until now.
Now, Dylan. Part of this is I was young once. I get it. When you're young, you're immortal.
Well,
and after about 20 years of that, you realize you're not immortal.
Oh.
And it's easier to get injured, and it takes longer to recover, and so on and so on. Your dad will tell you that. So one problem we're having is called the near miss effect.
What's that?
And so millennials, adolescents will they'll say, okay, there's a curfew, and yeah, there's social distancing, but I'm gonna go hang out with my buddy Billy for the day, and because he's my friend, he wouldn't get me sick. Well, Billy may be sick and doesn't know it yet. He may have been exposed and not know it yet. And so you go hang out with Billy all day. Well, you come home, I didn't get sick. I feel great. So tomorrow I'm going to go hang out with Billy and Joe and Jimmy. And then you come home from that and say, you know what? That's another near miss. I don't feel bad from that. So tomorrow I'm going to go to a frat party with a couple of hundred people there. And you come home from that and you say, you know what? I still feel fine. So I'm going to go to another frat party tomorrow night.
Sure.
And that's what's happening. And so the curfew is directed at everybody, but it's especially directed at the millennials who are spreading this thing, and they're not getting as sick as older people from it.
Mm-hmm. Wow, I never realized that effect was so prominent. But yeah, I can totally see myself even doing that, and I definitely know some people that have been doing that kind of thing. Like we all follow each other on Instagram. We're going to the beach. Of course, the beaches are closed now, but the near miss effect is definitely a real phenomenon, and it's definitely something that's it's a great explainer to what is happening with my generation. So thank you so much for explaining that.
You're welcome.
Very, very informative. I only have a few questions left, and then if you have any closing remarks, if you just want to drive some points home, I'm gonna let you do that, and then we can wrap this thing up. But Alexa asks, can a healthy adult die from COVID-19? She also asks, actually that's been covered before. She was just asking about pre-existing conditions, which we do obviously know that that it's somewhat of a race between the coronavirus and your immune system. Coronavirus wins, you're toast, but it's really your immune system that going like nuclear firestorm on you that kills you, according to what you've told me. But so I guess I guess her question is, can a healthy adult die from COVID-19 that doesn't have any autoimmune diseases? They don't have, as we said earlier, diabetes, not even asthma or scar tissue on their lungs. Could they potentially die?
Absolutely, it's happening as we speak. Wow. Again, it goes back to the viral load.
Mm-hmm.
If you're pick any age, if you inhale one viral particle as opposed to 100, if you inhale 100 viral protein particles, then there's a greater chance of you dying. So the answer is absolutely. So so again, it comes down to don't put yourself in a position where you're exposed to viral particles. Stay indoors.
Mm-hmm. Could we think of this as kind of like, I'm not sure if you're familiar with pirates and how they used to board the enemy ship and take it over, but could we compare this to like a boarding party for lack of a better term, and how like if the invading forces are bigger, then you're at more of a risk, but if you just have 2 or 3 people, they could possibly really do a lot of damage to a whole country. That's just the way I would think of it if I were to explain it to another person, that this amount of particles that you would inhale or that you would come into contact with would be contingent on the amount of severity of the virus inside of you. Does that make any sense at all? Or?
It's all about exposure. So if you want to use that analogy, that's a good analogy. Here's a better analogy. If there's pirates out there and they're deadly, and So what's the best way to not get injured by a deadly pirate? Stay away from them.
Sure. I mean that it's just really quite simple, but not very easy with this virus and social distancing. But I do it kind of all ties together. So that's pretty scary that a healthy adult can die from the coronavirus. We certainly don't really think about that, but it's happening. I know that. So Carson asks, what role has the media? So like the news, Fox, CNN, CNNBC. What have they had in over or under portraying the severity of this virus from a professional standpoint?
I don't think they're exaggerating the problem at all.
So they're right on the money.
Yes, I think they are.
Okay.
In the United States, yes. In China, no.
For
No.
sure. I mean, they're all, the government lies so much over there. It's just crazy. My last few questions are, they kind of tie back to China, but one question is quite important. These are just a few things that I was wondering. And then if I had this virus and the virus, I started getting pneumonia and all that, but then the symptoms started fading away, would I ever really know if the virus had run its course? Like, how would I know if the virus is out of me? And if the virus is out of me, if I do recover from this virus, does that mean I am immune to the virus?
I think that's a good question. We think so.
Really?
We think so. Yeah, we'll know over the next few months, but the answer, from what I've read, appears to be yes.
How many different strains are there? So I've done some research and I've heard that viruses, they do this thing called mutating, and it sounds like from way earlier what you said about the influenza is that like one of the reasons why we have to have a new vaccine every year or a new flu shot every year. The flu mutates and it becomes more, it just becomes different every year, and so the vaccines have to update themselves accordingly.
Right.
Do we know if this virus has mutated, and if it has, how many different strains are there out there in the wild of the coronavirus?
Okay, that's a great question. So from what I've read, there's one strain, and that's the danger. That's another danger that nobody's talked about with this virus. Three things have to happen to eradicate this virus. One, there has to be a vaccine. Two, there have to be effective treatments, which right now there's some hope in effective treatments, work that they were doing in China and we're doing here. Or three, the virus has to mutate to a less dangerous form.
Can it
Now,
do that?
some of the studies I've read this weekend, it does not look like the virus is mutating. However, the elephant in the room is, could the virus mutate to a more deadly form? Absolutely.
Well, that's scary, and it can just happen like that.
Yes.
There's nothing that it doesn't have to come in contact with a certain sequence. It just mutates. It just changes.
A virus and bacteria too, for that matter. Well, you can read about plasmids and all the immunology of bacteria and viruses, and the bottom line is if human beings reproduce a generation every 20 years, viruses and bacteria will reproduce in minutes, and they will alter their genetics to survive. And once they're exposed, I see this at my job. If a bacteria is exposed to an antibiotic that will kill it, the bacteria immediately starts altering its genetics to become resistant to that bacteria and survive. Their goal is to survive just like people.
Are they living?
Viruses aren't really living from this. They're just protein particles. But again, they will alter their genetics to survive. Right now, it looks like this virus is not.
But scary.
But we see this in the flu virus. Every year, the genetics change a little bit. Once every few years, the genetics change a lot. It's called antigenic drift. You can read about it.
But what you're essentially saying is, in the next minute, the virus could mutate somewhere, somehow, into another form. Not necessarily more dangerous, but not necessarily less dangerous. All we know is that it's going to be different if it mutates. Is that?
It could alter the proteins on its surface, where it's not. For example, if you're treating with an antiviral medication, then the more it's exposed to that antiviral medication, the more it will try to alter its genetics and the proteins on its surface to make it where that antiviral medication can't harm it.
This may go without saying. Does a virus mutating make it harder to develop a vaccine?
Yes, absolutely.
And
again, that's why we develop a new vaccine to the influenza virus every year, because by the time it goes from China southward to the southern hemisphere, and we hit it with our vaccine here. By the time 9 months later is in North America, so the virus recognizes that there's a vaccine, and the next year's virus will be a little bit different genetically.
So it's like a deadly game of ping pong.
Exactly right.
I never knew any of this. I mean, I don't even know how to say that. This is amazing, and quite grimly fascinating, if I do say so. Do we know, do we have an estimate of how many different strains are there, or is there just one? You said that we've been seeing just one strain all around, but I did see a chart. There's like a few more, but I'm not sure.
Right now, I just know of one. Okay. However, again, this is one of the SARS viruses, and there'll be another every few years, like flu. There'll be another outbreak.
So you're saying that the scary people were right in that it's going to hit us in waves? Is that inevitable, or?
I believe it's inevitable. Yes.
So.
Yeah.
But wow. Okay. We really need to do something. Like, as we've been talking, it's kind of been underlining just how scary this is. Wow, this is insane. So going like let's just end, where we began, and it's kind of hypothetical. I did say this question for the end because it is so hypothetical. What could the Chinese have done to prevent this virus?
They can stop eating wild animals.
Sure. Yeah.
Number one. Number two, they can close down the markets where they sell them.
Mm-hmm.
Number three, they can quit censoring information. They're mandated by the World Health to report any outbreak of communicable disease, and they failed to do that. They refused. President Trump offered the CDC to them. They refused. When World Health did send, from what I've read, when World Health did get scientists in there, they refused to let them out of the car. They refused to let them interview scientists.
That's just garbage. So
right. The Asian culture is very important to save face, and the culture of communism and socialism is proving that this is the best form of government and economy and economics.
Mm-hmm.
And so they'll tell you, well, we built 3 hospitals in a week, and we quarantined 1.10 million people or whatever, and because we have the military to force people to shut down, to quarantine the city and build a hospital. Yeah. And they're right about that, but also the same system created this.
Sure. China lied and people died. It's a very bad regime. So that pretty much wraps up all my questions. I'm glad that so many people ask questions, and I want to give a shout out to everyone again. It's just it just means it means a lot to me, and I hope that that you guys listening, you can go and spread this to your friends, and that you can spread the information that the Dr. Hash. I know your time is very, very valuable. And it's especially now that we are seeing cases all over the world. So I just want to thank you so much for being on the show again. It really means the world to me.
Well, so let me close with this.
Yeah.
One thing we didn't touch on, there are treatments that seem to be helpful if you're not very critically ill. There are some monoclonal antibodies that are working. There are anti-inflammatories that are working. There are antibiotics that are working because they are also anti-inflammatory. Mm-hmm. But you don't want to rely on that. And the main thing people seem to be, if you require a treatment, if you have COVID and require treatment, the first treatment seems to be oxygen.
Wow.
But again, why take the risk? I'm not going to take the risk.
Yeah.
My family, we quarantined for 2.5 weeks. I'm not going to take the risk. I don't. Again, everybody's mission should be isolate yourself from the public for the next 3 weeks. I don't want to take the risk of going to public and having somebody sneeze near me and I wind up on a ventilator or dying.
Yeah, it's that serious. It's that we are in a whole different ball game now. We can't take any risks with how infectious this thing is and the potential for it, God forbid, mutating. But some of these treatments, do you know of anything that we can do? Anything? I just want to touch on something that you told me through my dad a few days ago, which was to eat oranges and lots of vitamin C and melatonin. He said, or you said, helps too. Is that true, or what's your opinion on that?
So in sepsis, the body chews up a lot of vitamin C. So one thing the Chinese were doing, in addition to the antibiotics and the monoclonal antibodies, was high doses of vitamin C, high doses of melatonin, vitamin D also. And that seems to actually be helpful. And it all goes back to their antioxidants. And it stabilizes your cell membranes inside your lungs from breaking down.
Really?
Yes. So my advice to anybody right now is go order on Amazon or go to the vitamin store like I did, and order a big bottle of vitamin C. Order elderberry. Order vitamin D. Order melatonin, and start taking them. And zinc also. So, zinc has been proven to be helpful, a little bit helpful, against the cold virus. Well, the cold virus is it's in the family of coronaviruses. So the answer is yes. After you buy your, put on your mask and your gloves and go to the vitamin store and buy those, because it certainly can't hurt.
Yeah, and just to be very, very specific here, so people do know exactly what to get and exactly what they're looking for. The gloves that you're referring to, they are rubber gloves, like just the common latex gloves that you get at, say, Walmart. Are those the gloves that you're referring to?
Yes.
Okay, and the masks. Yeah. So I've heard there's disposable ones and there's ones called N95. Are either of those suitable for what you're saying?
Yeah, so N95, what the N95 stands for is it filters 95% of particles smaller than 3 microns. And so that's the standard for the viral particles. Mm-hmm. The surgical mask will allow larger particles of spit, whatever the virus is on, to go through them. But it's better than nothing. A bandana is better than nothing. And of course, if you're actually, what physicians are using, if they have to intubate somebody with COVID, they're using even higher quality stuff than that. Basically, they look like spacesuits.
Really? Is it the what you call BSL? Or no, that's the labs. The spacesuits, the hazmat suits, is what I was.
Yeah. Pretty much, yeah.
You mean like the yellow suits?
Yep.
Wow.
Yeah, double gloves, booties, hat cutters, glasses, glass shields, eye shields. Yeah.
I'm just curious now. Have you ever worn one of those?
I have in the Army for it's called mop gear for chemical warfare.
So when you were in the military, weren't you a paratrooper too?
Yes.
So you had to be trained in all that. And thank you for your service, by the way. We wouldn't have our freedom without what you did. It really means so much today, especially. You serve our country twice, really. You were a paratrooper, and now you became a doctor. So thank you so much.
Well, I was a doctor and a paratrooper, actually, same time.
Oh, well, double thanks.
No big deal. It's just a way to go to work.
We owe it to you, really. So that's pretty much all of the questions, and social distancing is very important, as we've discovered today. Just to wrap everything up, I just want to thank you for being on the show. And if we discover anything else, or if the situation gets worse, I'm just going to say I would love to have you on again. You know more than any of us will, and faster certainly than the media will, and faster than we will hear about it. It's just a real honor to have you on. I know your time is very valuable. And
so I'm going to add this to emphasize the dangerousness of the situation. About a month ago, a grandfather from Albany, Georgia, came to Tallahassee to visit his grandson. And he was sick at the time, the grandfather was. Mm-hmm. He didn't feel well. And so he took all of his family in Tallahassee and all the family in Albany that came with him to a steakhouse, and then they went to the mall, and then they went to an urgent care, and then they went to a car dealership, and then he went back the next day and went to the ER, and he died of COVID. In the meantime, all of his family members in Albany and Tallahassee mainly Albany, went to see him in the hospital before he had the diagnosis. They got infected. They all went to his funeral.
Oh, no.
People in the funeral got infected. So this started about 3 weeks ago, actually. So you can Google this. The situation at Phoebe Putney Memorial Hospital in Albany, Georgia, which is about an hour north of here, is they've got about every ventilator in the medical center used. About between 30 and 40 COVID patients on ventilators. 3 to 4 members of that family have already died. 3 to 4 are still sick. They've got about 40 to 50 patients in the hospital with COVID. They've got 7 or 8 staff members with COVID. The Georgia Army National Guard has quarantined the hospital. They're planning on opening up a hotel nearby to put more patients in it. This is one community. And that's just not that far from here. There's a nursing home not far from there. There's a nursing home in Pelham, Georgia, that on Friday had 5 patients with COVID. Now, this is with stopping visitation a week or 2 ago. The staff members who are not sick with it are bringing it in because they have it. So as on Friday, there were 5 patients in the nursing home with it. As of yesterday, there was 8.
Jeez.
So the death rate is, at this point in time, is growing exponentially. It took 1 month from late February to late March to have 1,000 dead in America from COVID. 1,000. It took 36 hours to go from 1,000 to 2,000. It is growing that fast, and it's going to continue to grow that fast exponentially every 36 to 48 hours until probably the 3rd week of April. And only then will it stop. Only then will it stop growing if everybody stays indoors.
Man.
And stays out of the public. So you do the math. Today yesterday we're at 2,000 dead in America. Where are we going to be tomorrow?
Over 3,000.
4,000?
Man, this is crazy.
Where are we going to be by Wednesday? 8,000? I don't know. But like I said, the virus doesn't spread itself. People are spreading the virus.
It's so scary. I mean, people really need to do what you're saying. You obviously know best in this situation, and it's really, really bad. I didn't know any of that, and that's close to where we are. So I really hope if you're listening to that, take it to heart, remember it, and spread it. This is serious, and you need to stay home.
Yep.
All right.
Not forever, just for a few more weeks.
Yeah. I'm going to let you go, unless you have any other stories like that.
No, I don't. I think this has been a good session. All I can say is everybody needs to stay alert, stay alive.
This is just an unprecedented time, and I wish you and your family the best throughout this outbreak. I hope that you stay safe.
You too, Dylan.
Thanks again, and I'll catch you later, all right?
Okay, you too. Thank you.
Bye-bye.
Bye.
I can't thank you guys enough for submitting your questions, and I hope that you will spread this message across your social media and to all of your friends. You can say, I appeared on a More Perfect podcast. My questions were answered. The advice that your health officials are giving you is so important and so critical. Now is the time. Now is the hour. No matter how hard mentally it may be, you're saving countless people. Again, we are everywhere podcasts are streamed, whether that be SoundCloud, Spotify, iTunes, Apple Podcasts, wherever you may stream. Thank you for listening, and have a more perfect and safe day.